Hello everyone, good morning, good evening, good afternoon, whatever time this lecture is going to get you. Welcome back again to Grapham Academy. Today we are going to handle what we call cardiovascular pharmacology, whereby we are going to look at the different conditions that affect the cardiovascular system, and then what are the drugs that we use for managing those conditions, and then what are some of the mechanism of action of those drugs, and which type of patients are always affected by that specific condition. So when you think of cardiovascular system, you think of a structure that is presented before you, and that structure is the structure of the heart. So we need to appreciate what are things that are found in the heart, what are the parts that are found in the heart, and maybe how do they help in the proper functioning of the heart. So on my right here, we see that we have the superior vena cava. The superior vena cava brings back blood from all over the system. It brings back blood to the right atrium, whereby the right atrium then pumps blood through these valves. It pumps blood to the right ventricle. And then when we look at below here, we have what we call the inferior vena cava. Inferior vena cava as well is bringing blood from all parts of the body. That's the deoxygenated blood. It brings back blood to the heart. So we can appreciate that the heart's main function is to pump oxygenated blood to all parts of the body. And then deoxygenated blood, it pumps it to the lungs to get oxygenated. So we can appreciate a few structures here. We can see here we have the descending aorta, and then we have the ascending aorta. So we see that this aorta has these branches, whereby on my left here, this is the left subclavian artery, and then I have the carotid, the left carotid artery, and then here this is the right carotid artery, and then the right subclavian, that is our artery. So when we look at the heart, we can also appreciate other arteries and ventricles, whereby we have the pulmonary veins and then we have the pulmonary artery, because we know that the pulmonary artery brings back, it takes blood from the heart to the lungs to get oxygenated, and what brings back that blood is what we call pulmonary vein. So we also have the left atricle or atrium, and then the left ventricle. Then we have the interventricular septum, which separates the two septum, and we can appreciate that the left-hand side, the walls of the ventricles are more thicker than the right-hand side, because the blood that the left ventricle is going to pump to the bigger percentage of the body. However, when you look at the right only pumps to the lungs, but the left has to pump it to all parts of the body through the aorta, systemic aorta and pulmonary aorta. So this is the conducting system of the heart. We need to know how impulses generated, where do they start moving from. In your free time, without maybe looking at this below, I would ask you to name this diagram on your own. Then when you fail, you can consult with these names that we have put below. We see that A is our pacemaker that we call the sinoatrial node, and then that is the pacemaker of the heart. It brings about contraction of the atrium, and then when it sends the information to the atrioventricular node, we see that the atrioventricular node can act like a shock absorber, where it has to absorb the generated impulses in a way that it doesn't send the way it has received. It has to analyze, and it has to determine how much should pass. Why it does that, we see that it enables the atrium to always empty the blood. But if it was just getting whatever it is receiving, you find that the atrium would contract without delivering, or without blood moving from one space to the other, because even down the pressure will have generated high, and yet it should be lower here and higher at the atrium, so that it moves down its concentration gradient, yeah, not against it, the concentration gradient. So we see that that's why it has to absorb the shock. Then when we look at number 3, we see that those are our band of branches, or we can say band of His. When we move to the other, we see that we have the Purkinje fibers, and after our Purkinje fibers, we see the different, actually we first have the Purkinje bundles. These are Purkinje bundles. This is a Purkinje bundle, and then the branches that come out of it are the ones that we call the Purkinje fibers. Yeah. So we need to have a brief introduction to the cardiovascular system, like we have just appreciated from those diagrams. We have appreciated roughly two things. One, we have appreciated the structure of the heart. We have appreciated the blood vessels of the heart, or the blood vessels that take blood and bring blood in. When we talked of the vena cava, we find that it is bringing blood from all the system inside. When we talked of the pulmonary vein, is the one bringing in blood from the lungs. Yeah. So we see that the only thing that we have not talked about is the autonomic nervous system. We know that the heart, being an organ in the body, it is supplied by this specific type of nervous system, which is involuntary. It has involuntary action. And we see that autonomic nervous system is divided into two. We have the peripheral, the parasympathetic and sympathetic. When information is sent to the heart, maybe or concerning the pressure or the blood pressure, you find that it has to go back to the central nervous system. So the central nervous system responds by sending us impulses. So how it responds can respond through the autonomic nervous system. The nerves are brought back in form of the autonomic what? Nervous system. It can either be a sympathetic action or a parasympathetic action based on the condition or the state at which a person is. For example, when maybe you have seen a snake and you want to run away, we see that the sympathetic action has to come in, whereby it brings about increase in heart rate. Why does the heart need to increase to contraction? We need it to increase because the body needs a lot of blood to be circulated. The oxygen should reach the muscles so that we are able to contract and relax the muscles, and the person is able to run away from danger. So if it is parasympathetic, that is on normal ground, like the person is relaxed, the person is not under tension, the person is not under stress. So you find that all these three systems or components are very vital when we are handling the cardiovascular pharmacology. When you look at the vasculature, we are focusing on the blood vessels. Yeah. So we have seen some of the blood vessels. We have seen the aorta, we have seen the pulmonary vein, we have seen the inferior vena cavas and the superior vena cava. So we see that all of them are very important. When we look at the carotid arch, we see that the carotid arch has pressure receptors, whereby if the blood coming out from the heart, that's from the left ventricle, has a low pressure, it's able to sense, and information will be sent to the nervous system. That's the central nervous system, and the central nervous system will release the sympathetic action, which will enable in contraction. Okay, so when contraction takes place, you find that other actions also take place to enable the pressure to be generated. You may find the RAS system also being initiated, and we are going to see how the RAS system can get initiated. So this is what I've been talking about. The autonomic nervous system helps to control blood pressure and heart rate. Yeah, and they are divided into two. We have the sympathetic nervous system and the parasympathetic nervous system. When we look at the sympathetic nervous system, we need to appreciate that this is located in very many organs in the body, and we have receptors for them. We have the alpha receptors and the beta receptors. So the alpha receptors are majorly subdivided into two, whereby we have the alpha 1 and alpha 2, and then we have beta 1 and beta 2 and beta 3. We also need to appreciate the neurotransmitter that is present when we are handling this nervous system, and the neurotransmitter we have here is norepinephrine, is our transmitter. So we need to know this neurotransmitter. We know that when these neurotransmitters are generated, they are going to bind to these receptors. When they bind to these receptors, they are going to bring about action or effect based on what has been released in that specific receptor. So those receptors, we call them adrenal receptors. So when we look at the parasympathetic nervous system, we need to appreciate the fact that the parasympathetic system as well has receptors, and those are the muscarinic receptors and the nicotinic receptors. Muscarinic receptors are divided up to 5, that is 1, 2, 3, up to 5. Then the nicotinic, we basically have 2. That is the nicotinic in the nervous system or in the neuron, and then in the muscle. Yeah. So that's what we need to appreciate. The neurotransmitter, when we are handling parasympathetic, our neurotransmitter is acetylcholine. Yeah. So we see that the vagus nerve is what delivers this information, or that delivers the impulses for the parasympathetic action. And this has effect on the sinoatrial node, which we have already discussed briefly as our pacemaker. Then we have the atrioventricular node, which is the junction. It will also have effect on the blood vessel or the vasculature, whereby it is able to affect the endothelium. The endothelium, the endothelium. So this is all about the receptors that we have just looked at. We have M2 receptors are present in the heart, and when acetylcholine binds to the M2 receptors, they are able to bring about contraction and relaxation based on what it is responding to. Then we have M3 receptors are the ones that we have in the smooth muscles of blood vessels. So it will also respond to this specific acetylcholine when produced or released, and either accept the binding or inhibit its binding based on the degree of stimulation. So the major function of the heart is to pump blood through the circulatory system, and we can appreciate the circulatory system, what it may contain. You find that you need the heart muscles themselves. So the heart muscles are located both in the atria and the ventricle, whereby we can appreciate we have 2 atrium and 2 ventricles in the heart. So when these muscles are present, they help in the contraction, and once contraction takes place, it's able to eject blood, or it's able to empty blood from one section to another. Then we also require the valves. We see that the valves help in preventing the backflow of blood. and we have two pairs of the atrioventricular valves and the two pairs of the semilunar valves. We need also the pacemaker system or the conducting system, which we have showed in the first lecture. I mean, in the first slides, we have shown how the impulses are transmitted from one part of the heart to the other. Then we have what we call the coronary circulation, whereby the coronary artery is the one which is able to supply the heart. Even the heart as an organ, it requires blood. We have just talked of the muscles. These muscles require oxygen to also participate or to be in position to make for us ATP, and which ATP may be required in muscle contraction. So the artery or the vasculature of the heart is when we have the coronary artery. That's why here we have just summarized it as coronary circulation, and it should also be drained. Yeah. So that's what you need to know. Then we require the autonomic nervous system innervation of the heart. We see that the heart is innervated by the autonomic nervous system, whereby we say we have both the sympathetic nervous system and parasympathetic, and we have digested their receptors, and we have also digested their neurotransmitters. So what do we expect to see in the cardiac cycle? This is like this lecture is giving you an overview what happens in the heart, so that in case we get abnormalities, we are referring to what exactly happened in the heart. Yeah. So we see that for cardiac cycle, you need to know what are the different stages of cardiac cycle. So cardiac cycle's main aim is to empty and bring in blood to the different compartments. That's both the atrium and the ventricles. So we need to know what will happen to the muscles in the atrium, what will happen to the muscles maybe at systole, at diastole, what exactly takes place, and how does the systole come about, how does the diastole come about. So we see that the systole is when the heart is contracting. That specific compartment can be the ventricles, can be the atrium or the atria. Then diastole is when it is at a relaxed state. Why it needs to relax, not only contracting, it enables in filling of these compartments. Yeah, it enables in filling of blood, maybe from the atrium to the ventricle. But if it doesn't have paces for relaxation, you find that it will be a condition which affects the system. So this is like a review, and you find that you have done this pharmacology for a very long time, or maybe the anatomy you have done, the cardiac cycle anatomy you have done, very many other things you have done. So what are some of the factors that could affect the cardiac performance? Some of the factors, we have what we call the resting muscle fibers, where we can see the preload, the end diastolic volume, or the end diastolic volume, and then we have the degree of the afterload, inotropic state, and frequency of contraction. So when we look at preload, we see that is the pressure within the ventricle after a successful contraction. Okay, so after the ventricles have contracted, or maybe when we look at blood from the cardiac cycle, we see that the atrium has to contract. When the atrium contracts, the pressure is generated inside the atrium, whereby that pressure is going to be high. When the pressure inside is high, you find that the pressure in the ventricle is going to be low. So the blood is going to move from high pressure concentration to low pressure concentration. So just immediately after the valves close, we see that the pressure within the ventricle, just after it has gotten that blood, maybe from the atrium, is what we call the preload, and it can be affected by the muscles. It is at its relaxed state. What's the pressure within there? So because sometimes the pressure within the ventricles just after the filling of blood from the atrium, can either determine whether this blood can have a backflow getting back to the atrium, or it will settle and stay in the atrium. So you find that it becomes a very big factor when we are handling cardiac performance. Then we have the degree of afterloading. Afterload is now after it has pumped blood to either the lungs or the systemic, like what pressure remains. Yeah. Contractility can be affected by a number of things. How is it contracting? What's the speed at which the heart is contracting? Yeah. So we see that the factors affecting the pumping efficiency, we see that what could be the efficiency? What would you understand by the word efficiency of the heart? Is the amount of energy required to pump a given volume of blood. So we see that conduction system abnormalities can affect the pumping efficiency. Anatomical abnormalities and pathologies can also affect the pumping efficiency. We can see compromised myocardium. Maybe there is little blood reaching the myocardium. That's what we call ischemia. Hypertrophy, increased cells or size of the cells. Yeah, can also affect, because when there is increased size of the cell, we know that a muscle is a tissue. So that tissue has cells. Yeah. So those cells inside that tissue can increase in size. When they increase in size, meaning the demand for oxygen and other things increase. When that increases, it's going to force some cells to die. When those other cells die, meaning that still the action or the pumping efficiency is going to be affected. The energy that's going to use is going to be affected. Afterload and preload, just like we have explained, and then the contractility can affect. How about what are the factors affecting the myocardial oxygen consumption? We say that the myocardium is a muscle, and it is a cardiac type of muscle, and it has involuntary action. We don't order it just like how we order the skeletal muscles. So just because of that, we need to know that it is always supplied with oxygen. Yeah. So what are the things that would affect the rate at which this muscle is consuming oxygen? We see that we have heart rate, the rate at which the heart is pumping. If it is pumping high, meaning there will be greater consumption of oxygen. The blood pressure. We see that if the blood pressure is high, the systolic pressures that we have just discussed and the diastolic pressures, if they are high, it means also we need a lot of oxygen to be there. Stroke volume, inotropic state. Inotropic, you should have gotten by now that whenever we are talking about inotropic state or action, we are talking about contractility. Yeah? So blood vessels, we need to appreciate the sequence of blood vessels, whereby from our arteries we move to arterioles, from the arterioles we move to capillaries, from capillaries we move to venules, and then from venules we go to veins. That's how it is arranged. Blood vessels controlling blood pressure. How do blood vessels control blood pressure? We see that blood vessels have smooth muscles in them. So those smooth muscles, when pressure is high or low, it is able to sense either by contraction or dilation. Yeah. So when they are dilated, we see that there are pressure centers on those blood vessels. Okay. And the major pressure centers that we call baroreceptors, we can find them in the carotid sinus, and we can also find it in the aortic sinus. So you find that it is able to detect the blood that's coming out from the left ventricle. If it is less, you are going to find there is constriction. If the pressure is high, we are going to experience dilation. And you find that the muscle is affected. Either there is contraction of the muscle or relaxation of the muscle. And how is information sent? Information can be sent to the brain through those baroreceptors, and the brain will respond by sending the sympathetic or parasympathetic action. We say that there are receptors of both the sympathetic and parasympathetic in those blood vessels. And by now, if you can remember that, you would be in position to maybe give them, or which muscarinic, which beta, is it beta what, beta 2, beta 3, beta 1, which one is located in the blood vessels. Actually, let me know in the comment section, so for me to be sure that you have been following right from the start. So we see that that can be the first action in which they help us they help us manage the blood pressure. The other one is the long-term way of managing. The long term is when we have the RAS system. We see that in the kidney we have what we call the nephron. The nephron has what we call blood vessels. These blood vessels take blood to be distilled, to be filtered from the heart, I mean from the kidney. So when we look at the nephron, we have what we call the afferent arterial and efferent arterial. So at the afferent arterial is where we have specialized cells for detecting pressure. Those cells are what we call the juxtaglomerular cells. Those juxtaglomerular cells are in position to secrete for us renin. When it secretes for us renin, that renin goes in circulation in the blood and it will go up to the kidney, up to the liver. When it is in the liver, we find that there is a hormone in the liver that we call angiotensinogen. The renin is able to convert angiotensinogen to angiotensin 1. And then for us to have angiotensin 1 converted to angiotensin 2, we need another enzyme, and that enzyme is going to be angiotensin converting enzyme. So our angiotensin converting enzyme converts angiotensin 1 to angiotensin 2. So angiotensin 2 gets back in the blood and it circulates. When it circulates, it has receptors at the distal convoluted tubule. At the distal convoluted tubule, those receptors, it will bind to the receptors. And what will it do? It will enhance retention of sodium ions and then expels out potassium ions or secretes potassium ions. And we see that it may not work alone, it will work hand in hand with what we call the vasopressin hormone, or what we call ADH. Yeah. So together with ADH, ADH is in charge of limiting secretion of water. That is by encouraging reabsorption of water at the convoluted tubule. So we see that in case the pressure was low, you find that we shall now increase the volume by retaining sodium, by absorbing more water, so the volume will go high. And still at the afferent, it is able to detect that it is now high, and as a result, we shall have managed. So this is how we regulate. This is what I've just talked about. The baroreceptors is the short-term way of regulating, and this is what happens. In detail, you can pause the video at these specific sections for you to go through it. The long term is when we employ the RAS system. Yeah. So this is how the RAS system would work. So these are some of the things that you may need to know when you're dealing with this cardiovascular physiology, I mean pharmacology. You need to know what Ohm's law is. You need to know what's blood pressure. How would we calculate blood pressure? What is cardiac output? How would I calculate cardiac output? Because we are going to be talking about these terms in the middle of the different conditions that would come about failure of the heart to work. Yeah. So in your free time, please pause the video and know what stroke work is, what is ejection fraction, what is cardiac output. Yeah. Thank you so much. This marks the end of our lecture. I want to thank you for your time, and for staying tuned up to this far. Kindly subscribe to Graph Academy for more videos like